Good afternoon. First, let me thank the organizers for this very good event. Before I start, I would ask if anyone in the audience is or has been working with hospital pharmacies, procurement, etc. Is anyone there? Okay, thank you. So you will understand the problems that we are trying to address here. I will talk about the supply, the eSupply, so the supply of healthcare products. I don't need to explain more, thanks to my colleagues, what is IHE, what is IHE doing, and what are the standards. So I will jump very quickly into the practical part, how it can actually help in practice and what can we do with it. So first is, so this is the streamline. What is IHE? So we basically take the standards and we make something concrete with it. We say these are implementable specifications. This is what you can do in practice in a hospital to fast track the adoption of the standards. As we have seen, that's important. How to do it, we facilitate that. We enable basically plug and play of healthcare solutions. If you want to purchase an equipment, an automated dispenser, you can spend 6 months asking where are the specifications, what can we do here, or you can say read this paper and come back in 2 weeks. So this is the optimistic vision of what IHE is doing. Now on the supply area, I've heard some very interesting comments here already today. Supply is a very important component of our lives in healthcare. It affects lots of clinical activities, OR, pharmacies, OR is operating room, the pharmacies, and the costs involved on purchasing this, the operational costs, the labor costs, is very important in any institution. So it's a very important area, and it's not just clinical. We cannot manage just the clinical part, and it's not just logistics, because the hospital is not a supermarket. There is something to it. So what we are doing here in IHE to facilitate the work of adoption of the standards, which as we've seen is important, we are trying to bridge those two worlds and say we are addressing the clinical part because in IHE we can do that. We have been doing that for 20 years. We are also addressing the logistics part. We are saying this is how they match. This is how they converge when we talk about privacy. In many areas, privacy is not important, but in healthcare it's extremely important. When we talk about safety, traceability, this is what we are explaining in the areas that apply to healthcare. A few areas of interest of healthcare supply. The inventory. The costs are very big in inventory. Keeping an inventory at the hospital or at the clinic is itself expensive. Buying that, so the procurement, the purchasing, is an expensive procedure. Optimizing that is expensive. It costs money, and it has clinical influences as well. If the medication is not available at the right time, what happens? Do we give equivalence? Do we wait for the treatment? So it has lots of consequences. Inventory scraping. How many units of products do we throw away because the contrast is no longer used, the medication has expired? How much do we throw away because the medical device was to be used by yesterday and today we cannot use it because we cannot assume that it's sterile anymore? So there's lots of costs here. Of course, the falsified products. That's a very important topic, and it's fortunately getting visibility. And the labor hours that, as a pharmacist, people that work in a hospital know how much of the time this really takes. So, given this problematic of supply, we are helping, or we are trying to help, we are providing enough expertise, to sediment enough expertise and put it at your service to help adopt something that can facilitate your life. And why? If you have an eHealth strategy, why should supply chain be part of that strategy? Because it increases the quality of care. If you control where the medicines come from and how they are delivered to the hospital, that is increasing, of course, the healthcare itself, the clinical, the quality of care, the clinical part. It reduces the costs, of course. If you know your inventory, if you optimize your inventory, if you avoid losing inventory because it's gone bad, it reduces costs. And especially for national programs, for national projects, or for regional projects, if you know what you're spending, if you know where your stock is, if you can say, this pharmacy is not consuming enough, I will not buy from that side, I will take from one pharmacy to the other, I will assign things from one place to the other. Or next year I will review my procurement strategies. this is also important to have insight into that data. So the key area is when do we start? So what do we do next? What are the next steps? I would say as a checklist, if there is a motivation for cost controls, if there is a need or a sensitivity for insight, for seeing what is happening in the supply chain in healthcare, and if there is already an existing infrastructure or existing technologies, existing frameworks for interoperability, then you have everything that you need for starting a supply. And supply, because of the operational costs involved in having supply chains, is an important step itself. It justifies itself. The costs justify the investment that we do in this project. So including supply in healthcare is a very good slice, and it can, first of all, it's easy to endorse compliance. Basically, we say we buy from this vendor if they are compliant with our supply infrastructure. So it's very easy to enforce that, unlike some clinical activities where it's more difficult to push standardization. There is a fast return of investment. With the amount, from my experience, with the amount of money that is wasted in inventory that stays there and is not used, or with the stocks that are not optimized, regardless of the excellent work that I've seen pharmacists doing, but there is so much work to do in a hospital that is not possible to optimize it to the level that guarantees clinical safety, that the product is always there, and there is not wasted stock. So the return of investment is relatively accessible, is relatively fast, and most importantly, the effects are lasting. So once you do that, as of then, you don't have to follow that program anymore. The strategy is there, the infrastructure is there. You say, from now on, please don't submit your invoices in fax, or by paper, or by phone. Just send the electronic file, and we know what to do with that. So this is the reasons for including it. I will not go through much to the standards, but I will just say that the cost of not standardizing is too high. I'm talking about paper-based ordering, no idea what happened with the products, having no traceability of the devices or of the medication. The cost of not standardizing, the cost of doing it in an ad hoc way in every place, this is too high. As a brief reference, the standards that were referenced by the colleague is HL7 and GS1. So what we are doing in IHE is to bring HL7 and GS1 and basically say, if we look at the hospital, these are the areas that we want to cover, or from the manufacturer, distributor, hospital, the dispensing systems inside the hospital, and to the patient, that's the center of care over there. We cover all the areas that are there to ensure that the products go safely until the patient, and whatever happens there, if there is a need for recall, if there is a need for checking for adverse events to control a batch, for example, there is a hemodialysis machine that has a problem in one of the filters, what was the patient's here, what was the patient that first complained about this, and which patients should we have to call to see if they have the same problem as well, looking at traceability of the machines, where are the devices, and on which patients have they been used. So this is extremely important to follow the full chain, and we use HL7 for that, more inside of the clinical workflows, and GS1 for adopting the universal standard for this. So I would finish this. I hope I have some 3 or 4 minutes to say what concretely can we do with it. With the profiles that we are having today, so the profiles will be out in a few months. We are looking at facilitating the electronic product consultation, so checking what products are out there, querying for products, or I need a vaccine for this, what are the manufacturers? So getting a list of available products in the market, ordering those products and tracking the delivery of those products in one single way for all the vendors. Meaning that if I'm a hospital, I go to my system and I enter things, I need this stent, I need this vaccine. Please, someone help me. And I don't have to care about calling all the participants, I do it once. The advantage of this being a single channel is that from the moment you get orders, you can very easily compare prices. You can very easily see who is responding or not. What are the conditions that they offer? What are the conditions that they follow? I understand that negotiation of prices is a very important thing in Greece. I'll go there in a second. But this is, if we have this in one channel, it's possible. If we have one channel, one way of addressing each manufacturer, it's just impossible. So the ordering is important. The inventory control is the usual work of everyone. I think once per year here in Greece, you have to scan, you have to check the inventory at a pharmacy or at a given location and see what are the products available there. So if you have to do this once a year, you might as well have some barcodes. It would help a lot. And if you have some barcodes, you might as well know that the barcodes will end up in a central harmonized database that you can check that if the products are okay, if the products are suspect of being falsified. So this is important information to have in a structured manner. And of course, dealing with product returns, product recalls, checking if I don't have to go to the pharmacy if my system tells me, hey, there is an item that is going to expire in 1 week if you don't consume it quickly. So this is the kind of thing that we want to support. We are doing some material already. So we have a white paper that is coming up very soon, and just recently we made a short educational paper to explain why interoperability matters, for example, in the support of the Falsified Medicines Directive in the European Union. So this was done very recently. So we are covering a few areas. The first edition of the profiles would cover this, inventory ordering, traceability and management. The second edition will cover invoices and the catalog of products. And I'm about to finish with the first saying that the fact that you have information, you can have some KPIs. You can start having some local, regional or national or even European level KPIs to see what are the average lead times for the product, what are the deviations. If I have a tender, what are the conditions of my tender being respected throughout the end, or do we just, as a hospital, do we just buy half of what we should have bought and then we go in the direct adjustment to direct purchase to buy the rest of the stuff at the more expensive price, or our policy is enough. So if what we want to also to provide is the facility or the ability to get this data visible to you and thus produce all the KPIs that we want. Local and regional KPIs, so how much time and money are we spending on specific items, what's the variability of supplying costs and times, are all the vendors, or what are the vendors that are most compliant with our national guidelines for purchasing. If we say 90% at least 90% has to be consumed within the time of the tender, is this being followed or not? So just a few ideas what we can do, so we can check if the products are about to be expired. We can check that we have stock, our minimum stock level is 100. But if we have a surge of, for example, the common case is meningitis, if we have a surge of meningitis, the usual stock is not enough. So even before the stock breaks down, we might want to call this. This is possible with such an integration. This is happening out there. So there are initiatives in the US and in Germany, especially, those are the key relevant ones on eHealth supply. It's still pretty much seen as an operational thing, but these two countries, they are advancing on this as this is not just operational, this is clinical and operational, this is important for everyone. And to wrap up, I would say, what can we do here? So IHE will present in the next coming months a set of profiles, guidelines, cookbooks, ideas, compilation of articles in a short technical document, and we'll say this is what IHE has come up for you to facilitate the adoption of standards. So what we endorse is to say use this to put eSupply as part of your eHealth roadmaps. If you have an eHealth program, see if supply fits there. Integrate with clinical aspects, with privacy aspects, with all the strategy and economic constraints that you have. Use these standards, create, and very important here for programs, create a platform. Let the innovators join in. So here's the data, here's the platform, and then please let the universities optimize the inventory levels. Let the vendors support this in filling this with their data. So this is always create a platform and let the innovation join in. And this is a shortcut for doing the following. You can start with a project, select a few sample sites, see it, the return of investment is very rapid if we talk about supply. And if we try this, if we set up the benchmarks with a few sites, with the right endorsements coming from the right levels, if you just see the impact on tenders, procurement, and the falsified medicines, you will get a very good feeling of what this is about. And that is also what we ask as IHE editors and authors of standards, is from the communities. If you have these problems, let us help you bring these things to reality, and let us also see the feedback of adopting standards. This is how we help. We want to help the communities, and this is also we grow as standards. This is what we want to bring to you. So thank you very much.